Hello, good afternoon, Mendocino County, and welcome to the COVID-19 Friday update. Today with us, we have Dr. Noemi Doohan, our health officer, as well as Becky Emery, our Department Operations Center Manager. We'll start off with Dr. Doohan giving us a COVID-19 update. Then we'll go over to our media for some question and answer. And then we'll take a few questions from the viewers today. So if you have any questions throughout the presentation, go ahead and leave them in the comments, and we'll try to get to as many as we can today. With that, I'll turn it over to Dr. Doohan.
So greetings, Mendocino County. We're not only in the middle of a COVID surge right now, but as you know, we're all very aware we're dealing with fires, and we're also dealing with that it's a hard time right now, and we will get through it. So to start with data, as you probably are all aware, we've been having challenges with data and it coming in a timely fashion to us. This is not only the reporting of results coming to us from laboratories, but also the state recognizing those data points that we have, like number of deaths and number of positive cases. So to give you an example of this, the number of cases that we have currently in Mendocino County is 584 cases. If I look on the state monitoring website called the Snapshot tool, they list us as having 487 cases. So we have 584, the state is recognizing 487, so they're about 100 cases behind us. The state monitoring data shows 10 deaths. As of today, we have 15 deaths. So we had 5 deaths this week. Of those deaths, 3 of them were being cared for at Adventist Health Ukiah Valley Hospital. One of them as recently as today. One of the deaths occurred at Sherwood Oaks Nursing Home. This was an individual who had COVID somewhat in the distant past, but died at Sherwood Oaks. And the other was a patient that was transferred out of Mendocino County by Adventist Health Ukiah Valley to an outside hospital, which is something that happens. Hospitals will transfer patients out to what we call higher levels of care. So we had 5 deaths this week, 4 being hospitalized patients and 1 being at a nursing home. So we have 584 cases and 15 deaths. And the doubling time that our data shows is 23 days. That's the number for that's the number of length of time for the number of cases that we have to be predicted to double. The state has a 28-day doubling time for us, so similar. You can think of it as about 3 weeks. Another piece of data that we look at very closely, right now our local data is matching the state. That is the number of cases per 100,000 population in 14 days. We have a population of about 90,000. So currently, the number of cases per 100,000 in 14 days that the state is recognizing is 183 cases. That's 183 cases per 100,000. When we get above 100 cases per 100,000, that is when we go on the watch list. When we get above 200 cases per 100,000, that is when schools can no longer open through the waiver process. So our data is consistent with the state that we have about 185 cases per 100,000 in 14 days. So we are close to that 200 per 100,000 breakpoint that would not allow schools to reopen with the waiver process. As you know, I've been coming to these media days for weeks now, saying that our data shows that we should be on the watch list, that I've been communicating with the state, telling the state we're seeing data that should qualify us for the watch list, and we were told that the state did not see that data. Well, as you know, there was some explanation for that at a high level, that the state monitoring system, CalReady, had crashed, and that was why there was a data lag. And that is being cleaned up over the last week and a half by the state. So in that process of the state rectifying their data, I was called on Sunday night by the state to say, now we're seeing what you all in Mendocino County have been seeing since late July. Yes, you're on the watch list. The thing that was very surprising to us in Mendocino County is that we were placed on the watch list retroactively. So the state placed us on the watch list as of July 25th. And this was in fact when I was seeing the data with our DOC that qualified us to be on the watch list. The state, now looking back, has recognized that. The problem that created for us in Mendocino County was that there is an implication for the schools, because when a county is on the watch list, the schools are not allowed to open, and they have to go through a waiver process that first comes to the health officer and then goes to the state, and the state looks at those waivers and makes a determination about whether the schools would be allowed to open. So we had to scramble this week to get that waiver process in place. And this was very challenging because I had been telling the schools what I had been hearing from the state, which is if you're not on the watch list, you don't need to do the waiver process. You're not on the watch list, schools can open. So we had a number of schools planning to open this week, opening this week, and then all of a sudden we get this news on Monday stating that, nope, you have to go through a waiver process. So we worked very closely with the schools. Thank you to Supervisor Ted Williams. Thank you to our incoming health officer, Andy Corin, who hasn't even started the job yet, but has already started working. He starts on Monday. And with the collaboration of the schools, Dr. Corin, Supervisor Williams, we were able today, just now, as I'm speaking, we are submitting waivers for 10 schools in Mendocino County that are, I have approved their reopening plans through Supervisor Williams and Andy Corin. And these 10 schools are Montessori Del Mar, Deep Valley Christian, Mendocino Unified, St. Mary's Catholic, Ukiah Junior Academy, Willits Unified, Waldorf of Mendocino County, San Jose Sanchez del Rio Catholic School in Fort Bragg, Pacific Community Charter, and Ukiah Unified School. This does not mean that these schools are opening for full in-person learning. I don't want to say that. You should contact these schools if this is your school for your children. What is allowed in these schools in their reopening plans is only to open up to grade 6, up to and including grade 6. When a county is on the watch list, it is not allowed for 7th grade and above to open for in-person learning. So these schools that have submitted their reopening plans and we're sending it up to the waiver process for the state, which we did today, it's only through K through 6, and it has to comply with the state guidances on school opening plans, and it's for modified in-person learning. In other words, they have to follow the state's guidance on in-person learning for schools. 7th and above has to have distance learning because we're on the watch list. So this was hard this week to get this news, to get it so quickly and really last minute, and at a very difficult time for our schools when they didn't know that they would have to go through a waiver process, and nor did I. So thank you to every one of these schools for working so rapidly and diligently and carefully to have reopening plans in place so that you can open as planned. The other thing I wish to speak about is fire. So we know we're living in state of emergency from fire now. One of the areas where we had to rapidly respond, in addition to all the usual areas where we respond to fire, is through the lodging. So in our lodging partners across our county, the sheltering in place orders has limited lodging so that they have to keep 25% of their rooms empty and have 24 hours of cleaning time and vacancy before they can rent a room. So I lifted those requirements on all of lodging for fire evacuees. So for fire evacuees, there's no requirement for the lodging to reserve 25% of the rooms or have a 24-hour cleaning period. In fact, that is why in the order I put in the sheltering in place order that hotels and other lodging must keep 25% of their rooms on reserve, because I knew we would be coming into fire season. I hoped we wouldn't have any fires, but this seems to be our new normal. And it's very concerning as we're having fires, that we want to avoid people being in congregate settings like shelters to the extent possible. So for those individuals who are able to go into a hotel, we want that to be possible for them. We are also doing the work on our public health side to prepare shelters for Mendocino County so people will safely be able to be sheltered if they are a fire evacuee in a congregate shelter. So there's an FAQ that has been released and distributed to the lodging industry that specifies that they are able to release rooms for fire evacuees. The other thing I want to speak about are outbreaks. So we did have an outbreak at Sherwood Oaks. This outbreak does look like a skilled nursing facility. It does look like it has been contained. So we have very good results from that response. And thank you to Sherwood Oaks and all of the partners, including Adventist Hospital, that worked so hard to contain that outbreak. And thank you very much. I also wish to mention that Ukiah Post-Acute, that we did have with Ukiah Post-Acute a situation where we thought we did have an outbreak. That's a skilled nursing facility. This has been shared with the press, that we did have six individuals that worked there that had COVID, but it turns out when we did further investigation that these 6 individuals actually did not pick up the COVID at work. They actually picked up the virus outside when they had some connections outside of work. So that was not by the rules a workplace outbreak, as we did further investigation. So I want to share with the public that when we define something as being a workplace outbreak, that is based on the fact that the outbreak is transmitted in the workplace from one person to another while they're working. And so when that happens, we can ask for the state to come in and help us. And I've done that with the outbreaks at Sherwood Oaks and with Ukiah Post-Acute. And when the state comes in to help us, they will additionally look at our data, for example, and tell us what their findings are regarding whether it's a workplace outbreak or not. There has been another outbreak that we've been responding to as well in another clinical medical environment, which I'm not going to speak about publicly, except to say that we are working to contain it. It looks like it's been contained, and the state is coming to help us with that one on Tuesday. I also I want to share some success stories, some hero stories. And I was preparing today to share the stories of our whole person care program, a team that is led by my Megan Van Sant in our Health and Human Services Agency. And I want to say that I intended to spend quite a lot of time today focusing on that. But the schools, the issue of the schools and the waiver and the watch list came up for us very rapidly. And I shifted my focus this week. But I do intend to share those success stories with you because it's very heroic regarding our people experiencing homelessness and our people with chronic issues with addiction and mental illness. But I'm going to be saving that for a future media day because I want to give time for the media to respond. So that's going to be it for my updates today, and I will be taking questions.
Thank you, Dr. Doohan. So we'll start first with KMED, Matt Lefevre, who submitted his questions electronically today. So the first question, which is 2-part, is there are reports that evacuees from Sonoma County fires are heading north to seek refuge. What sort of issues do you see manifesting with the convergence of evacuations and Mendocino County's COVID-19 concerns? What best practices would you suggest to municipalities and individuals who are hosting these evacuees?
So as I said, we did open up more hotel rooms that we had on reserve with the sheltering in place order. So 25% lodging has been opened up, and that requirement is waived for the cleaning of keeping the room dark for 24 hours. Additionally, I know Becky Emery is on the call. Becky, would you like to speak to all of the hard work you've been doing to prepare the shelters?
Certainly. Thank you, Dr. Doohan. We have been evaluating all of the needs for sheltering in Mendocino County to ensure that we are not only able to respond to the need for sheltering of fire victims, but also in response to the need for COVID-19 and implementing various screening projects to make sure that our response is making sure that we are evaluating for individuals with COVID. We have an alternate care site where we will be asking those individuals that have tested positive for COVID to be sheltered. Additionally, we are looking at spacing within the shelter, cleaning schedules within the shelter, showering schedules within the shelter, a lot of things that we've not had to do previously, even the meals and how those will be delivered and eaten are being evaluated within a shelter system, and looking to ensure that we are doing everything that we can if we do open a shelter to prevent COVID within the shelter and the spread of COVID as well. So we really appreciate Dr. Doohan's efforts in being able to talk the steps through with her and ensuring that we are preparing for everything that we need to do to keep our community safe, increasing the amount of supplies that we have available additionally, such as hand sanitizer, masks, gloves, PPE, personal protective equipment that is necessary for the staff that'll be working in the shelter, as well as making sure we have the things that we need to be able to support our community to that effect. And in the event that we are called on for Sonoma County to provide these supports and services, we would apply these same preparation tactics and things that we have been putting in place to that shelter as well.
Thank you, Becky. So the next question is, there is a reoccurring narrative that Mendocino County's cases are driven by tourism. Please speak to this narrative. Is it accurate? Why or why not?
Well, we just don't know because we don't test tourists necessarily. And if they're coming from an outside county, we wouldn't get their results. We can only presume that people are coming to Mendocino County from other counties, might not be wearing facial coverings to the extent that we might want them to, might be traveling and interacting with others outside of their homes in ways that they wouldn't if they stayed home. So we don't know. The answer is we just don't have the data, and I don't know that we ever will. So the way to ask that question is for those areas of the county where there are tourists, to look around and see if people are complying with our local orders. Are they wearing facial coverings? Are they maintaining social distancing or not? And those behaviors will give us a clue of whether tourists are spreading COVID. I will say that what I hear from the lodging industry is that they are being very excellent ambassadors to our tourists. And certainly within the hotels and the lodging industry, I'm not having any evidence whatsoever that tourism is spreading COVID in the lodging itself. But what we don't know is what they're doing when they're out at the beaches and enjoying our beautiful forests and beautiful other areas of our county.
Thank you. So next up, we have Sarah Reith with KZYX. Sarah?
Hi, thanks. Can you hear me?
Yes.
Okay. I'd like to circle back around to Matt's question about some of the evacuation sites. It sounds like the alternate care facility on Whitmore Lane is being considered as an evacuation site. And we learned last week that that has 24 rooms. So I'm wondering if there are more sites that are being considered, like the usual schools and gymnasium colleges and the fairgrounds, and how we're juggling that, since we just learned in Sonoma County that they had to give up their OptumServe site to use the fairgrounds to evacuate people. So what are some additional places that are under consideration for evacuations?
Becky?
Certainly, thank you. Hi, Sarah. So we are looking at the alternate care site only for those individuals that are positive for or in isolation or quarantine already identified by Sonoma County. For our shelter sites, we have an alternate care site, or excuse me, we have fire shelter sites. We work with the schools. We work with, as many people know, we have had the last couple of years shelters at Mendocino Community College, and they have been a fantastic partner in that effort. We have worked with Ukiah High School, Willits High School, Fort Bragg, we have a lot of options. Round Valley High School as well has always stepped in and been a great resource for us. We continue to work with these same partners and have reached out to various partners throughout Mendocino County to confirm that their availability is still there for us in the need of a fire shelter or other disaster shelter. And that's where we would look first. As I said, we would implement screening for those individuals so that we can ensure or do our very best to limit the spread of COVID by having those individuals that are identified as COVID positive currently in isolation being cared for at the alternate care site.
And just a quick follow-up, are we at risk of losing the OptumServe site if we have to use the fairgrounds, or is an evacuation, or is that even a possibility?
I don't feel that that's a site right now that we would be looking at and thereby lose. There's multiple buildings at the fairgrounds, and our partnership with the fairgrounds has always been a good, strong partnership. And I really feel like they would work with us and our needs. So I know that a goal for us will be to continue with the OptumServe availability for our community. We recognize how vital it is. And also to ensure that we have the ability to provide shelter to anyone that needs it through any other disaster that may occur.
And my next question has to do with a letter that was going to be sent and then wasn't sent by the Board of Supervisors to ask the state for some further clarification about the state's reasoning for closing down certain sectors of the economy, namely like salons and pedicurists and personal care professionals like that. And that letter ended up not getting sent because there was some confusion about when we were going to be on the watch list. And I'm just wondering if there's more dialogue going on with folks at the state to determine why some sectors are shut down if cases have not been traced to those professions, if we have more information about where cases come from.
Yeah, I guess. Oh, yeah. Go ahead, Sarah.
To say, Supervisor John Hastrack and Ted Williams did finish that letter, and that letter was issued today and sent to the governor's office, the governor, his team, Senator McGuire, Assemblyman Wood, our two county associations were a member of. So that letter did go out today.
Yeah. And to respond more in depth, Sarah, to your question. So, you know, I think the first case of community transmission in the state of California was, I believe, from a nail salon. And that may be why beauty and the whole concerns about, you know, nail salons were at the top of the mind of the governor when that particular sector was placed on the high risk businesses. Also, when you just think about the nature of having someone work closely towards your face, which you have to do on the nails, or on your face if people are having facials or waxing, it's a higher risk exposure, and it would be protective if we could have N95s or surgical masks on, you know, in when someone's having their haircut. But those are in short supply because we need them for our frontline healthcare workers. So there is that concern about that particular industry because of the exposure of the workers themselves, and as well as the people receiving those services. But nonetheless, there is definitely, you know, the concern by health officers across the state that the sectors, what we call the watch list sectors, the higher risk businesses, that they're not all equal and they shouldn't all be closed all at the same time, and that maybe some of them should be opened earlier. Well, right now we're in the situation that the governor has made very clear that if you're on the watch list, all of those higher risk businesses need to put their businesses outside, into the outside environment. And I did put those orders in place before being placed on the watch list. And in fact, the governor has not put orders on Mendocino County closing those sectors because it's been acknowledged that they already are closed. And that I closed them back when we retroactively were placed on the watch list now, as we've learned. So we are retaining local control on those sectors, which is what my intention was. There is discussion that among the health officers and with Dr. Pan, who's our health officer for the state, about looking at a sector by sector approach to reopening, so that, for example, we could reopen beauty salons, or there may be other names, hygiene services, places where people get their hair cut is certainly more than just about beauty. It can be about needing to go to work, and it can be for many reasons why people would access these services. We are advocating on the health officer level to have a sector by sector reopening instead of all one group. The governor is apparently going to be making announcements in the next week about that, but we would not be able to reopen those sectors at this time without going into violation of the state. And one other comment is, once you're on the watch list, as long as you're on the watch list, those sectors must remain closed. There's no waiver process for them.
And I'm wondering if there's any effort to include information about how people have gotten the cases, just so that people can have more information about what's safe and what's not.
You mean, there's no, let me put it like this. When there's an outbreak, which would be when we would have the concern about getting COVID from a place or a group of people, public health responds. And so there are no outbreaks happening in our community now that you, the public, aren't aware of, because we've talked about them in the public. So there, you shouldn't be worried that if you go into a grocery store, you're going to get COVID because there's an outbreak there, because we would have shared that information. So if it's a business, there's no business actually there's no business outbreaks right now that we are managing in the business sector. So with an outbreak, we define it as 3 people that have been epi-linked at their workplace. So we're showing that they're actually spreading it to one another at work, and we don't have any business outbreaks at this time. What we do see are gatherings, spreading within gatherings. So people will see there's a spread within a family or within a household or within some people attended a party. But you would know if you were at that party, because you would be being contacted by public health. But one other follow-up on this, as we see the situation now where we have fires breaking out all across our state, and we have firefighters rushing to contain those fires, and then where our resources get spread. That's a very good analogy to what we're dealing with in Mendocino County with COVID. So it's important that individuals react themselves. If there's an outbreak and you know that there's been an outbreak because you attended a party and 3 other people got sick, you yourselves should act on that by giving information to your neighbors if they were at the party, by knowing that you should quarantine if you were exposed. You should quarantine for 14 days. And public health will be responding as well, but you individual citizens and people of our county that can respond individually, it's very, very helpful to public health.
Thank you.
Thank you. Next up, we have Adrian with the Mendocino Voice.
Dr. Doohan. My first question concerns Dr. Cottle's announcement about the death of the person at Sherwood Oaks, and I also want to use this to give you an opportunity to discuss how these things get defined, because Cottle said that the death was COVID related, saying that the man had COVID, had pneumonia, COVID related pneumonia, recovered, was well for a week, and then died of a pre-existing heart condition. And so Cottle referred to it as COVID related. In the official statistics from the county, it's referred to as a COVID death. I know there's a lot of discussion about this in the public at large, and I know there's been some reporting that actually COVID deaths are undercounted nationally. So I wanted to give you an opportunity to maybe unpack some of those definitions and explain that a little more clearly.
Yeah, so what we do in Mendocino County is that if someone has had COVID and been sick for COVID, and they have COVID on their death certificate as being a condition related to the death, we just are calling it a COVID related death for our account. We're not splitting hairs on it. Because someone might acutely die from COVID, where they're admitted to the hospital, they're sick with pneumonia, they're diagnosed with COVID, and then they die in the hospital. They never go home. Then that's pretty clear, usually, that it was COVID. There's other cases where they go home or they go to a skilled nursing facility and they die sometimes later. And we're still calling that a COVID-related death. You know, when people have been very, very sick and their health then becomes undermined by that infection, they might die of a heart attack, but it was really that infection that weakened them. So we're just, I don't know if that's a clear answer, but at this point, we're not splitting hairs. If they've recently had COVID, been sick with COVID, we would call it a COVID-related death. There are other circumstances that we have where, let's say, a pregnant woman comes into the hospital to give birth, and she isn't sick with any COVID symptoms. She gives birth, gives birth, and then maybe has her baby, right? And then maybe this has not happened in Mendocino County. Okay, I'm just giving an example. Maybe she dies of some other reason of complication of maternal death. I wouldn't call that a COVID-related death because the COVID didn't make her sick. So some people are asymptomatic. They don't get sick from the COVID. They might die from something else and be found to have COVID, but there doesn't seem to be a real obvious connection because their cause of death was obviously something else, like a car accident or something else. These cases all clearly were sick from COVID. And whether they died a couple of weeks after they had COVID or they died right, a week after, the COVID was the cause of their illness.
So just to be clear, because this is something that people are discussing a lot, you would make a distinction between people who had COVID and died incidentally, and people who are dying effective of the illness itself.
Yeah, that is what I'm doing now. We may get those numbers corrected by the state at some time. They might say, oh, that's not really a COVID death. But, to be absolutely clear, if someone is asymptomatic, they've been diagnosed with COVID, and God forbid they're hit by a car and died, I would not call that a COVID death.
Okay, thank you, doctor. My second question is about your general appraisal of the situation. In the last few days, we've seen a decline in new cases from upwards of 20 down to 4 or 5 per day. I know you don't have a crystal ball, but are we seeing is that the curve being flattened? Is that another data artifact? Is that just, some random fluctuation? Can you speak to that?
Yeah, I think it's a data artifact. Our average number of cases in the last 14 days was 12. So when you average out, I think we had Becky knows these numbers by heart. Like, I think we had a day we had like 20 cases. Oh, we had one day when we had, what was it, Becky, like 50? And then we have 5. So if you look at the data over 14 days, it's been about 12 cases a day. The average is 12 cases a day for the last 14 days. So I think our average is solidly 12. We know we're going up in our cases because we were at 100 per 100,000 about a month ago. Now we're getting close to 200 per 100,000. We're not seeing it flattening out yet. We're still seeing it rising.
That 100 per 100,000 number is 100 active cases in isolation or in the hospital?
Yeah, because it's in 14 days.
Okay.
So it's meant to be active, although some people present for testing from an infection they had a while ago. But it's 100 per 100,000 is 100 cases per 100,000 population in the last 14 days.
Okay, so you don't see that curve flattening, but the doubling time does seem to have increased from somewhere in the neighborhood of 2 weeks to 17 days previously to a little higher, 20. I think you said the state said 23. I have to check my notes, but
yeah.
It's that doubling time is increased. Is that a good sign, or am I just trying to find silver linings where there are none?
I think you're trying to find silver linings. There's always silver linings. But I think that particular one, I think our data right now is coming in a bit of fits and spurts because we're still seeing some of the data lag from what was happening at the state and the labs, their lab delays. So I would say we are not seeing a slowing down yet. Do remember that we did have the prediction by the state based on the modeling data that we would hit our peak around Labor Day. I think that I don't know that we'll hit it around Labor Day, but I think that we may see our peak in September.
Thank you, Dr. Doohan.
Next up, El Punta, Jackie, George.
Hi, thank you. Mi primera pregunta es, Quisiera que nuevamente nos pudieran repetir acerca de cuál es el proceso para hacerse el examen de COVID-19. Sobre cómo qué se debe hacer, a dónde se tiene que acudir para hacerse la prueba. Para las personas en los siguientes escenarios. Si es que una persona ha estado en contacto con alguien que ha dado recientemente positivo, para una persona que tiene síntomas o para una persona que no tiene síntomas.
Okay. I would like you to tell us the process for taking the COVID-19 test. What does the person need to do? Where do they need to call to make an appointment for the people in the following scenarios? If a person has been in contact with someone who has tested positive, this is the first scenario. The second one, if a person has symptoms. And the third one is if a person has no symptoms.
That's an excellent question. Excelente pregunta. The first category, close contact, they should stay home if they can and quarantine for 14 days. And then on the 15th day, they could go for surveillance screening or to their primary care, but they should realize if they test positive, they might be asked to isolate for additional time.
Ok, para el primer escenario, la persona lo que tendría que hacer es, primero, es mantenerse en cuarentena por 14 días y en el día 15, esta persona podría hacerse un test, le llaman el test de vigilancia, para ver si es que se vuelve positivo o no. O ir a su doctor y explicarle que ha sido contacto con alguien que ha sido positivo y hacerse el test para poder verificar si efectivamente ha sido contagiado o no por el contacto que ha tenido.
But if the person tells us, I quarantined for 14 days. I had contact with someone, but I've quarantined, I have no sickness, and I tested positive, it's possible, well, we would decide their length of isolation with them. We would discuss with them how long they would need to isolate.
Ok, y si alguien, por ejemplo, ha estado, que ha resultado positivo, esa persona tiene que estar en aislamiento. De lo contrario, si es negativo, tiene que estar por un periodo de 14 días en cuarentena. O sea, tiene que hacerse una diferencia entre lo que es aislamiento y cuarentena. Recordemos que aislamiento es para aquellas personas que han resultado positivo y cuarentena es para los contactos de las personas con alguien que ha resultado positivo.
If they have symptoms of COVID, then we want them to reach out to a healthcare provider to get further instruction. Or if they're very sick, go directly to the emergency department if they need care.
Okay. Si la persona empieza a tener síntomas, entonces tiene que inmediatamente contactarse con su doctor primario para que a través de él pueda canalizar el procedimiento a seguir. Y si no tiene un doctor primario, entonces tendría que acudir a un establecimiento de salud para que allí pueda ser descartado, él o ella descartado si tiene la enfermedad o no.
And the third case, the person who has had no close contact and they don't have any symptoms, this is perfect for OptumServe or any of the surveillance testing that we're doing around the county. George, the OptumServe number to call to make an appointment is 888-634-1123. 888-634-1123, or appointments can be made on the website for COVID testing, the OptumServe website.
Ok, para aquellas personas que no han tenido contacto ni tampoco han tenido síntomas, entonces esta es una buena oportunidad para ir al campo de la feria donde está la compañía de laboratorio OptumServe Para poder sacar citas allí, habría que llamar al teléfono 888-634-1123.
Cuando la persona se va a hacer el examen a la clínica, el examen tiene un costo.
Okay. When somebody who is tested with the virus, this test has a cost.
It depends on the clinic that they go to. So this is something that they should ask of the clinic where they're going to go for care or the hospital. But in general, depending on the situation, the cost for COVID testing, the person is not charged in general.
Okay. En general, esto debería ser gratuito. Sin embargo, debería preguntar la clínica. Cada clínica puede tener sus propias políticas de atención o de asistencia para estas personas.
Ok, mi segunda pregunta es, de acuerdo a los reportes, una de las causas principales de contagio son las reuniones o fiestas. ¿Qué medidas va a tomar el condado o está tomando el condado para desanimar, desalentar o convencer a las personas de que no lo hagan? La mayoría de las fiestas ocurren durante el fin de semana cuando el centro de atención telefónica de COVID-19 está cerrado. ¿Hay planes de tener este centro abierto durante los fines de semana?
Okay. According to the reports, one of the main causes of infection is gathering or parties. What steps have been taken to discourage or convince people not to hold this type of events? Most of these events take place during the weekend. This happens to be when the COVID-19 call center is closed. Any plans to staff the center in the weekend?
So that is not a question that I have the answer to as the health officer. May I ask Sarah Duquette to respond?
Well, I'll try to do my best, and maybe Becky can help out. So we do have the special investigation unit, and they are working 7 days a week. And I'm not sure if they're taking calls or if it's just emails.
If I may, Sarah, yes. So while our call center is not staffed 7 days a week, the number 234-6052 is available, and calls that people are reporting for gatherings, as you're talking, are rolled over to a dispatch center, who then takes those reports and forwards them on to our investigators who are going out and responding on these events. So the calls are still coming in, and we are taking those reports and responding that same day.
Becky, could you please repeat the phone number?
Sure.
Es el 234-6052.
Oh, okay. Okay.
Thank you, Jackie.
Okay. Bueno, se ha creado una unidad especial de investigación acá en el condado que está tratando de localizar estos lugares en donde se están haciendo estas reuniones. Si bien es cierto, el call center no está atendiendo, pero ellos toman los mensajes de voz. Estos mensajes de voz son leídos por esta unidad especial, y esta unidad especial ya se encargaría de hacer la investigación y apersonarse al lugar para tomar medidas.
Ok, gracias.
Thank you. So we have about 15 minutes left here. So we're going to take some of your questions live from the comments. So we'll try to get to as many as we can. Go ahead and leave them in the comments. We do have quite a few. So we'll start with the first one I saw, which was, where is the new health officer? People have been hearing Dr. Corin's name and are curious. And I think you briefly mentioned it before.
Yeah, so I think Dr. Corin is actually here with us, and he can unmute, and this would be a great time for us to have him say a few words. But before he does, I want to say that Dr. Andy Corin, who we've been calling a local hero because he is, has been, like local heroes do, been volunteering his time before he's even started his job. So he starts on Monday, but he's been working with us. For example, this week, he worked very hard with us on the school reopening plans and the waiver process, along with Supervisor Williams. He's also been helping with the healthcare facility outbreaks and many other areas of our pandemic response. So he and I speak regularly and are in communication regularly, and he'll be joining our team on Monday. So Dr. Corin, would you like to say some words?
Sure, I don't see my face. Oh, here I see my face. Hello, everybody. I will be joining the health department formally on Monday. I'll get oriented. But your participation in the media is very welcome, and it helps us know what the questions are out there and how we can better inform the public. So I'm looking forward to joining and you know, being more involved. Maybe not so looking forward with excitement, but well, with excitement I am. I want to do my part in this pandemic, and I hope I can help. And anybody who wants to get in touch with me, I would welcome that.
Thank you. Our next question is, what is our daily testing capacity, and what is the testing average for the past couple of weeks?
Oh, I have that number. The average tests per day that I have for Mendocino County, and Becky, you can confirm this, is 303. Average tests per day, 303. That is from the state snapshot tool. So that's what the state is seeing for Mendocino County in terms of tests per day. And that's well above the recommended 1.5 per 100,000, I think it is, per day that we should have.
Should I mute myself? We have another question come in. How many people are currently in quarantine?
I know that we have 86 in isolation. I would ask Becky if I don't have that data right in front of me. We know that number. I, as a health officer, don't have it right in front of me. I have 86 in isolation. Maybe Becky can find the number for quarantine.
I will pull that up before we finish, and I'll have that just before we finish.
Here's another question that goes along with it. How long is the delay now between testing and receiving results?
Well, it depends on where you're getting the testing. So people have testing in private labs like Quest and LabCorp and ARUP. There's a number of different private commercial companies. I've been hearing up to 2 weeks for that, but it seems like it's getting a little bit better. If you get tested at the hospital, on the other hand, they have the testing equipment there, and some of our clinics have the testing equipment there on site, and you would get the result within the same day. But for those results where we have to ship them away to commercial companies, it can be up to 2 weeks. I don't know what it has been recently. UCSF surveillance testing has had some delays as well. Becky, can you speak to the turnaround time for OptumServe? We do have 257 in quarantine.
That's correct. We have 257 in quarantine, going back to our prior question. And as to the OptumServe, you know, our timelines are definitely speeding up. The state has added additional labs to help process those tests. At this time, our average is 3 to 5 days on the OptumServe return. And the state has been tracking that very closely. And I would say we're in the same range of 4 to 5 days as our return time on the UCSF current tests, with the additional portal that they've added and changes that they have made as well. So we have seen a significant decrease in the return time for those testing results, which has been really good.
And then if we choose to do outbreak testing, which is when we take the samples to the Richmond Public Health Lab, the state lab, we have a turnaround time of 72 hours.
Our next question is, could you please clarify the quarantine requirements for close contacts of people who are being tested for COVID that are displaying symptoms and are awaiting their results?
So quarantine is for people who are not sick. Isolation is for people who are sick or are a positive COVID case, because you could have COVID and not have any symptoms at all. So isolation is if you're COVID positive or you're sick. Quarantine is for people who are not sick. So if you are a close contact of a COVID case, meaning you've been closer than 6 feet for more than 10 minutes, you should quarantine for 14 days away from other people. If you become sick during that time, then you should reach out to your healthcare provider and let them know, because you may have converted to a case. So our concern is that when someone's in quarantine, their 14-day quarantine, they might get sick anytime during that quarantine. And if they do, that's when they could be actually becoming a COVID case and need to isolate.
We have a couple people in the comments saying that they know some individuals who are getting letters that they tested positive for COVID, but they've never gotten tested. Have we heard of reports of that, or if that happens to them, who should they call?
If somebody got a letter that they tested positive, but they never had a test, I have not heard of that. They would have to, I would certainly suggest calling whoever sent them that letter. I would have to know where they got the letter from to know how to answer.
And I'm looking at our DOC manager, and I don't think our DOC has had any reports of that happening.
We have not that I'm aware of, but certainly I would encourage those individuals to reach out to us through our call center, the 234-6052. I think it would be beneficial also if we could get a copy of that letter so that we can try and validate or debunk whether or not it's an accurate letter. Because especially if someone is saying they haven't been tested, I don't see how they could have gotten that letter. But certainly we want to make sure that we are working with our community to ensure that they are safe and well. And so I don't want to just say no, but without being tested, I don't see how somebody could have gotten that type of a letter.
Yeah, definitely be safe out there, because we are hearing of, different types of scams and things like that. We have another question for Dr. Doohan. Do you have any thoughts regarding the testing strategy being put forth by Dr. Michael Mina, who spoke at UCSF's Grand Rounds last week, to have quicker, cheaper, less sensitive testing that might actually help with getting in front of the transmission of the virus?
Yeah, so I think it's very tricky, because this is, what we're talking about here is really of great benefit on a public health level, because it gives us awareness of where the virus is, but it can be very difficult for individuals because the results are not as sensitive. I'm not sure what Dr. Michael Mina, what particular test they're talking about there, but it's probably the antigen testing that we do. It's like a rapid, what we call point of care test, where people can do the test even in their own home. And so you might be familiar with that, like the rapid flu test that we get, or let's say a strep test. That's one that people are familiar with. You can get the rapid screen in clinic. And then if it's positive, we might do a throat culture, the throat culture being more accurate. So the problem with these tests is that they're not necessarily that accurate, and people can misinterpret the results. I would say that can be the concern, but I would agree that what we need is rapid point of care tests that people can do in their homes. That would be the ideal. And this in particular, just to call out one particular scenario, would be extremely helpful for teachers and schools, so that the teachers could perhaps do their own tests and mail them away for their surveillance testing and know that they're okay to go teach that week in school, for example.
Our next question is, what's our next steps moving forward? Is there anything else we can be doing besides sheltering in place when we can and wearing a mask to kind of slow the spread and get through this quicker?
So one of the most important things to help the public health response is for people to individually understand what isolation and quarantine means, and to follow these behaviors. If they're sick, they should isolate and stay home. If they've been in touch with a person who has COVID, they should quarantine. What would not be beneficial is if people sit back and say, I'm not going to do anything until public health contacts me. And this is a behavior that I've seen that's been very disappointing to us in public health. If you know that you've been exposed to a case, someone who has COVID, that's sick with COVID, you should quarantine, and you shouldn't wait for public health to call you to tell you to do that. That's what the blanket quarantine orders are all about. So I would ask every person to read the blanket quarantine orders that are on our website and understand what it means to quarantine and when you should quarantine. Certainly, anyone who's had close contact with a known COVID case should be in quarantine.
We have time for one more question. Dr. Doohan, currently there's a popular Spanish post going around in social media with misleading information about herd immunity locally. The post claims that when people are asymptomatic with COVID, they are not infectious, but rather are communicating or spreading antibodies. Could you please talk about this?
Yeah, so that's untrue. There are two different types of asymptomatic people with COVID. One, they're asymptomatic, they never get sick. And we know that that's the case because we've had those cases and we've monitored them in Mendocino County. Then there's people called pre-symptomatic. Those are people that generally have no symptoms for 48 hours before they get sick. Or let me say it like this, they're infected, but they have no symptoms. Sorry, let me start again. These are people that are infected with COVID. They don't get sick until they're farther along in their infection. And the 48 hours before they get sick, they're very infectious. Okay, we call that pre-symptomatic. None of these people are transmitting antibodies. Antibodies are only made by the person themselves who gets COVID. So the only way to make antibodies that we know of with modern science is if you actually have COVID and you get sick with it. So you can't share antibodies with other people unless you share your plasma, which we don't recommend unless you're a hospital.
Thank you. Thank you to Dr. Doohan, to Becky Emery, Dr. Corin, and our journalists for joining us here today. If you joined us late, you can watch the replay here on Facebook or on YouTube, or you can look for a written recap later today. I want to thank you for joining us, and we'll see you again next week. Have a wonderful rest of the day.